Next, I'd like to introduce Stephanie Lee, who's already been introduced here. Dr. Lee is an associate professor at the University of Washington at the Fred Hutchinson Cancer Research Center, where she is an attending physician at Fred Hutchinson's long-term follow-up program. Her research focuses on areas such as chronic graft-versus-host disease, late effects of transplantation, patient quality of life, and physician-patient communications. She sits on the executive boards of both the American Society of Hematology and the American Society of Blood and Marrow Transplantation. Dr. Lee.
Thank you very much. I'd like to echo Steve's words that it really is a pleasure to be here and to support all the work that nbmtLINK is doing. I also want to say that actually I am here sort of on behalf of ASBMT, the American Society of Blood and Marrow Transplantation, which is the major professional organization in the United States, and we're very much supportive of your work and this whole effort. I also want to say that as I was listening to the stories and everything, it's always struck me that on the one hand, people have to be, you know, we're doing amazing things, we're doing more transplants, we're curing people, and yet it's not perfect, as Ellen said. And I think I've always been, you know, sort of really, you know, I don't want to just cure the disease. I actually want people to be well. I want them to feel well. I want them to go back to work. I want them to go on with their lives and not have to deal with continuing effects of treatment. And so I think that's why I ended up in chronic graft-versus-host disease and patient quality of life and the other sorts of measurements. Because I really am optimistic that if we keep working on things, we will make it all better. What Myra and Denise have asked me to speak about tonight is to try to give you a flavor of the kinds of research that is going on in the United States and around the world trying to approach some of these problems that you've heard about. And so this is not going to be very extensive or exhaustive. I'm going to leave out lots of things that are going on all over the place, but I wanted to give you a sense of what's going on, how we're thinking about these things, and hopefully some hope that in the next 5 to 10 years we really are going to make significant progress. Steve, as you were showing your life history, he always has that, you know, 2002, went to the NIH. I always call him our mole. Because, you know, we were all working out here on chronic graft-versus-host disease, and then Steve got into the NIH, and he had the consensus conference, and it really, that was a thing that I think really united people. We are having meetings, you know, when we go to our meetings, we have groups of people, and there are people all over the world at those meetings. So we are poised, I hope, to make progress in chronic graft-versus-host disease. And actually, at the end of my talk, I'll talk about some of the other issues besides chronic GVHD that we know affect our survivors. Okay, so just to jump right into it, because Steve gave you a little introduction to chronic graft-versus-host disease, I just wanted to mention some large clinical trials that are going on trying to prevent the complication in the first place. So there actually was just published in September a European study of ATG, so anti-thymocyte globulin. This is a way of trying to deplete the T cells in the graft to hopefully prevent acute and chronic graft-versus-host disease. And this was a very large study, 202 patients. It was randomized. This was done in patients who were getting unrelated donor transplants and having myeloablative procedures. And they did find that there was less extensive chronic graft-versus-host disease. Actually, it was quite striking. It was 12% versus 43%, highly statistically significant. So some people have said maybe we should just use this in all our patients who are getting unrelated donors. Well, you know, in medicine we like to have at least another big trial, maybe a couple more, to really make sure that we know what's going on. And so actually the Canadian Bone Marrow Transplant Group is planning to conduct their own large randomized study using a different preparation of this anti-thymocyte globulin. It's going to be done in unrelated donor transplantation. And importantly, it's also going to include people who are getting reduced intensity conditioning. Because remember, the prior study was all with myeloablative procedures, and that's actually, you know, we're doing quite a few of the other types of transplants. That's going to have 200 patients in it, and that's being supported by the Canadian equivalent of the NIH. Another study that the Canadian group is doing, and I just happen to be involved in these two trials, which is why I'm highlighting these, but many other people are doing similar sorts of things. The Canadian group is doing a randomized trial, interestingly, of G-stimulated bone marrow versus G-stimulated peripheral blood in matched siblings. And this was based on a very small study, randomized study, that actually suggested that you got less extensive chronic graft-versus-host disease if you used a bone marrow graft that had been stimulated by G-CSF as opposed to peripheral blood. That trial is hoping to enroll 230 patients. They already have about 130 enrolled, and that is actually funded by the National Cancer Institute. And so I think when we get through all of these trials, we may actually have a better approach to try to prevent chronic graft-versus-host disease in the first place and hopefully decrease the burden on patients afterwards without affecting, very importantly, relapse rate and cure of the disease. Actually, I should say on these trials, I think what is also unusual about these two, particularly Canadian trials, is that the goal of these trials is to prevent graft-versus-host disease. You didn't actually see that before. I think that we didn't have good definitions. People were more focused on acute GVHD and sort of the early complications. Now you're actually beginning to see trials where we're trying to prevent chronic graft-versus-host disease as the primary endpoint. What about treating chronic graft-versus-host disease? Well, Steve gave you that long list of, I think, 24 or 28 agents. That's sort of been what's going on in the field. Lots of single centers doing their own look at what happens. And the problem with that is that you get a lot of things that look sort of okay. And yet, as we know when we're treating patients, it's really pretty much trial and error. You try one thing, then you try another thing, you try another thing. So the Clinical Trials Network, which is the big cooperative transplant research group in the United States, actually plans a very large study, a 500-person study. That's a huge study. It's funded by 3 institutes at the NIH, and they are going to be looking at trying to improve treatment for patients who have high risk or poorly responding standard risk chronic graft-versus-host disease. First time they're attempting a chronic GVHD trial. I think this is showing that the field is starting to mature, and we're actually looking for real scientifically based ways of improving care of patients. And as Steve also alluded to, we've been very successful, thankfully, to get some funding. So we have funding from the NCI through a UO1 award and through the Office of Rare Diseases, because graft-versus-host disease is a rare disease in the United States, to put together a consortium. So we currently have 9 clinical sites, including the Hutch, Dana-Farber, Stanford, Minnesota. And the plan with this, you can see the patient advocacy groups on the bottom, nbmtLINK is there. Thank you, Myra, for your support. The goal of this consortium is to conduct clinical trials. So we're going to be having a study looking at cutaneous sclerosis and different treatments for that, for lung problems, for steroid refractory disease, and we're really trying to do this in a multi-center way to try to get some very good data about what works and what doesn't work. Okay. Another thing on why it's important. I think there's no doubt that chronic graft-versus-host disease, while many people, do very well and function very well, it would be better if you probably didn't have it, if you could get rid of it. And this just shows some data from a study, the Bone Marrow Transplant Survivor study, which is showing you that patients who have active chronic graft-versus-host disease in the black do report more problems with general health, with mental health, with pain, fatigue, with being able to hold down a job. Whereas if you look at the patients who are in the white, all these patients had allogeneic transplants. They are, much lower risk of problems. And if your chronic GVHD resolves, you actually go down to as if you never had it before. So this really gives weight to the idea that it would be great if we could prevent it, get everybody in those white bars. Or if you were at least in the black bar, let's get you down into the gray bar where you don't have it anymore. And hopefully that will improve quality of life.